Good evening, all. I would welcome you all to the 14th edition of TM's Medalog. Today, we have a very important and a distinguished alumni of Tanjore Medical College of 1981 batch, Professor Raveendran sir. And I invite Dr. Ravi sir to introduce Dr. Raveendran sir to the audience and kindly mute yourself upon entry so that we have an uninterrupted experience of the talk. Thank you.
Thank you, Dr. Venkatesh. I take this opportunity. I am actually very privileged to introduce Dr. Raveendran, who was our senior when we entered the college. At the same time, I will also take this opportunity because he ragged me for 3 hours. When we entered the college, he passed out in 81. We entered in 81. So I distinctly remember the 3 hours I was sitting in his room, and he was questioning me everything about in the society. So that first meeting itself showed that Dr. Raveendran is such a different person. He is always out of the box. You cannot put him in a box. He is always out of the box. He finished his MBBS and then he was in JIPMER from 8. It was a very, very long innings. After his MD in JIPMER in 87 till 2024 when he retired as a Dean of Research. So such a long innings in a reputed institution like JIPMER. He has trained so many people. He not only his own pharmacology students, but also the other postgraduates in research, because he has got a great record of training people in research methodologies. That was his main goal. So he has 66 publications and 5 book chapters. But the most interesting thing, as I told, is the out of box thing is this: he is a software man. So even in 1990s, 80s, and early 90s, he was into software and medicine. So how we can integrate software in medicine, and in his field of pharmacology, he has got some 6 or 7 software packages which are still in use. So some of them are being regularly used by students. So that was his special interest. He has 5 book chapters to his credit, and he was the chief editor of the Indian Journal of Pharmacology, as well as the Journal of Pharmacology and Pharmacotherapeutics, and he has been editor for almost 30 years. And as I said, his main interest is conducting workshops for PG students. He has done more than 50 workshops and for regarding the research methodology, statistics, and everything related to research. And he has also published a book, how to do a practical approach for the PG students to do dissertation. And his work on an alternate to animal model. So he is interested in avoiding the animal killing or animal torture for the sake of research. And he has attended conferences in Tokyo, Montreal. He's going around the world for regarding this particular topic on alternate to animal research. Today he is going all around the world taking his camera. Once he retired, he is an avid photographer, and you can see his excellent photos in his Facebook page. So I would recommend people to look into his Facebook page. And one last thing about his work: his passion was his study about plant Oduantari. I remember him telling me about his work on Oduantari, which is a poison neurotoxin, and he has done extensive research on the how the receptor works and all those things. So today we will have a excellent presentation of his body of work for now over 40 years. Thank you, Venkatesh. It's an honor. Thank you.
Thank you, sir. Now the floor is open to Professor Raveendran for giving his talk. Sir, please go ahead.
Thank you. Thank you, Venkatesh and Ravi, for your kind words, and as well as giving me a chance to deliver a talk on the forum. Thank you so much. Without wasting time, let me get into the business. And of course, those who are seeing the screen might be wondering why I have posted this. The first page of Financial Express, which appeared in 7th October 2011. And if you see 2010 paper by team under Ames Chief, lifted text from 2005 study. Yes, We all like to be, in the limelight. If our name appears on a newspaper, especially in the front page, yes, we will be very happy. But then if it is going to be, the news is going to be something like this, and it is going to be a big problem for us. This is not a, something nobody, likes. And this is something, he has plagiarized some Ames chief. I mean, it's a director of, he was director of Ames. And what I'm trying to say is, you do something like this, that is an unethical thing, and then that is come back and bite you, when you are holding a big position. This happens. Whatever you do when you are a student or when you are a junior faculty member, and people may not mind it, or they may not say anything at the time. And when you become a vice chancellor, then immediately, by the time you take charge, if you see the newspaper, this kind of news will greet you. This has happened. One of the vice chancellor in Karnataka, he became a vice chancellor. Then a news item appearing that he has plagiarized his PhD thesis. So what I'm going to, yeah, maybe for another 30 or 40 minutes, I'm going to talk about publication ethics. And I have been editor for, say, almost 30 years, from 1993 to 2023. I have been chief editor in 2 journals. Of course, I have seen a lot of these things, unethical things practiced by contributors. So this is one of my pet topics. Now, what is publication ethics? How will you define publication ethics? It is nothing but code of conduct for contributors to biomedical journals. Contributors doesn't mean only authors, the reviewers also. Reviewers also contributing to journals, and as well as those who are running the journal, those who are funding the journal, those who are running the journal. So they are also contributors. So this is a set of code of conduct for contributors to biomedical journals. And it is nothing but a self-regulatory mechanism insisting on integrity on the part of authors, peer reviewers, and publishers to establish higher standards of editorial processing for the scholarly journals. When you say journal, we are talking about scholarly journals, biomedical journals. Of course, no, I don't have to give any examples. We all have seen journals, we all have read journals. So when we say journals, it's a scholarly journals. It is not something, journal which is published in-house or newspapers or some this thing. Okay. So why should we bother about publication ethics? Okay. There'll be a lot of unethical things going on in business and other things. Now, why should we bother about ethics in publication? Now, remember that every single case of fraud or misconduct reduces public confidence, abuses the use of public and charitable funds, and causes insult and frustration to the vast majority of careful and honest workers. Okay, so now when you are doing research, where do you get the funds from? Most of you don't spend funds from your pocket. Now, either the institute is funding, especially if it's a government institute, then where does it get funds from? From the government. That's a taxpayers' money. Or you get it from a funding body, either ICMR, DBT, DST, whatever it is. So all these are government agencies, and these government agencies get funds from the government, I mean, from the Ministry of Finance. And this money is for taxpayers' money. So when you are getting taxpayers' money and you try to commit fraud or misconduct and you violate ethics, then this is going to be a very, very bad repercussions or very, very bad results. So that is why we are bothered about unethical things that are going on in publication. Now, what I am showing you is a staircase of misconduct. Now remember that misconduct or unethical publication practices, unethical research practices, this may be intentional or maybe non-intentional. Okay, if you see 1 to 21 are given, if you see The top ones are non-intentional. It may be a unintentional, or some things, no, they are intentional. And it may be a misconduct or it may be an error. Sometimes it may be a honest error. Okay, when you are analyzing the data, you used a wrong statistical test or you used a wrong software and unintentionally you have made a mistake. So that is unintentional. That is okay. But then, no, if you commit fraud, fraud is no intentional. You're committing fraud. And sometimes, no, it is easily detectable. Sometimes, no, it is easily detected. Sometimes it is not detected at all. It is very difficult in detecting it, especially wrong observation, wrong analysis, and inadequate record keeping, withholding method details. If you are doing all these things, I mean, no, it is very difficult to detect. Whereas plagiarism and fabrication, and if you see illegal human experiments, this may be easily detected. Now, what do you think? Is violation of publication ethics common? Now, this is a bit old data from Nature. Now, if you see, falsifying or cooking research data, ignoring major aspects of human subjects requirements, if you see, this is not uncommon. You say that, you may say that, it is all 1.4. I mean, the score is very less, the percentage. Totally, they studied, I forgot the data. Somewhere it is given. In the title it is given. Sorry, it is blocking it. Yeah. The N is equal to 3,247. And then if you see the percentage may, appear very low, but then, that shows that it is not uncommon. And if you see, other behaviors, publishing the same data or results in 2 or more publications, more journals, and inappropriately assigning authorship credit, withholding details of methodology and all these things. So these things are not unethical publication practices are not uncommon. And is a misconduct on the rise. If you see again, it's a bit old data, 2011 data. They say that no, it is on the rise. If you see, I mean, even if you go to the web, and then there is a website called the retraction. I mean, the website which publishes all the retracted articles. If you see the retracted articles are now so many articles get retracted. The misconduct in the unethical publication practices, misconduct in research are increasing. Now, what are the reasons for violating publication ethics? Now, if you see in the picture, I mean, it's a Japanese scientist, and he did he committed some fraud. He published it, and everybody, there was excitement. Whatever he published was totally. Whatever he published was it was it was kind of a head-shattering kind of thing. And finally, what happened was, it was found out that it was fraud, and finally he committed, he killed himself. He committed suicide. Now, what are the reasons for violating publication ethics? Now, sometimes, as I said, it may be unintentional, ignorance. Out of ignorance, you commit some mistake and then, you publish it. That is unintentional. And sometimes you may get trapped. Now, let me tell you, never ever believe your PG student or senior resident. If you ask them to do something and then they do, they copy, from some other publication and then come and give it to you. And without checking it, I mean, you also believe them. Without checking it, you are going to publish it. You are going to get trapped. Okay. Sometimes, you ask somebody and then, he doesn't like you. And then what he does is he simply copies it and then gives it some few paragraphs, enough. It goes to a journal finds out, and journal, it is saying that it is all plagiarized. At the time, you cannot withdraw in the sense, I mean, you cannot, you have to take responsibility. You cannot say that my PG student has done it. Okay, my co-worker has done it. No, that will not be acceptable. You should have gone through it and should have checked it. So that is why I say, never ever completely believe your PG students. Sometimes they also might not know. They may not know that the plagiarism is unethical. They might not know They plagiarize and then simply come and give it to you. And many times it is intentional. Now, because of publish or perish culture. Now, if you apply for a job, and now somebody has published 10 papers, you have published only, it's a, let us say, entry-level job. Fine, it is okay. Somebody has published 10 papers and you have published only 2 papers. And who is going to get it? The person who is going, got more number of papers is going to get it. And promotion. Nowadays, MCA, now everywhere. Now they insist on published papers. You should have published at least 2 papers in a year, or 2 papers, to get promotion. So you have to publish something. And the grant writing. You go for grant. You ask for suppose if it's a couple of lakhs, they may give it to you. If you are in a very lower level, and you ask for a couple of this thing, they might give it to you. But then if you ask for a large grant, it's a very big grant, they are not going to give it to you. They want to see your track record. So how many papers you have published? You want to get a good, a large amount, couple of crores you want to get. They're going to see your track record, your publications and all these things. So now here you commit some unethical publication practices and then try to publish it or this thing. Now sometimes instant fame. That's what we saw in the Japanese example I showed you, the Japanese scientist. You publish some earth-shattering thing. Immediately, everybody is going to get excited. And then they say that, it is fantastic and all these things. But then now somebody is going to expose you. There's an instant fame. It is going to be, it will be followed by shame. Immediately somebody going to check, and then they will say that immediately they are going to expose you. You are going to be, it is going to be a shame for you. Now, what are these unethical publication practices? I'm going to list the multiple submissions, guest authorship, fudging the content or data, undeclared conflicts of interest, redundant publication, plagiarism and not declaring the use of AI, then inappropriate acknowledgements. So these are, the list is not exhaustive. There may be many, but in my experience, if you see, these are very common. And the latest one is use of AI and not declaring that you used AI. So otherwise, a lot of other things, all these things are very, very common. Now let me discuss one by one. Manuscript submission. When you are submitting manuscript, don't submit more than one journal at a time. This is what is called, Ingle finger rule. Okay, in biomedical journals, especially biomedical journals. Well, this may not be applicable for physics journal or chemistry journal. Okay, there, what people do is they submit to a database. Okay, physics, physicists and chemists. What they do is they write a paper, they submit to a database, and then they send email to multiple journals. I have put up my manuscript in such and such a database called archive or something, this thing. If please go through it, and if it is suitable, you please publish it in your journal. And whoever the journals go through it, and then if they want, they publish. Otherwise, they don't publish. So this is okay for physics and chemistry journals. But in biomedical journals, you cannot publish it more than one journal. You cannot submit it more than one journal. You cannot publish it also. And if you submit it to one journal, and then you want to you don't like it, or they take so much time, and then what you have to do is you have to withdraw, and then only you can submit to another journal. Or you get a communication saying that they are rejecting it, they don't want to publish it for some reason, and then you can go for another journal. But then simultaneously, your paper should not be considered in more than one journal. Then final version should have been read by all the authors. That is very important. Whoever is authors, you may have 10 authors or 20 authors or 2 authors, 3 authors, all the authors should have read the final version. And don't submit it without the consent or knowledge of the co-authors. Suppose you are a first author, or you are the main author, you are the submitting author, or communicating author, but you cannot submit it without the consent or knowledge of the other authors. If you are doing this, if you are going to do this, then this is unethical. Then authorship. This is a big problem, not only in India, it's everywhere, even abroad. The authorship is a very big problem. Now remember that not giving authorship to those who have made significant intellectual contribution. The keywords are significant intellectual contribution. Now, what is the significant intellectual contribution? Well, you cannot define it. They should have contributed significantly, and also it must be an intellectual contribution. Now, your PA typed your manuscript. That doesn't mean that C deserves authorship. There is no intellectual contribution there. Okay? Your technician has analyzed all your sample. Now the technician is not going to get authorship. No. That is, the technician is paid for doing the work, and then he has not intellectually contributed. So the significant intellectual contribution, if anybody has done that, and then they should be given, given authorship. If you don't give them, then that is unethical. Giving authorship to those when they have not made significant intellectual contribution, that is unethical. Refusing to take public responsibility for the study, or at least a particular section of the study after the publication, that is unethical. Once it is published, and then some query is raised, how did he do this? No, this is not correct. Well, you have to take responsibility. No, this is how we did it in our this thing. Now we have the data, we have the raw data. If journal asks, we give the data. At that time, you cannot say that, no, I didn't do it. I didn't do this work. No, my students did it. No, I simply signed it. I only know communicating author, corresponding author. No, I don't know. Or I am the last author. I didn't know. No, you cannot say that. At the same time, sometimes some people cannot responsibility for the laboratory work, but then they can take responsibility for the design and the statistical analysis. For a statistician, you involve a statistician, and he is there from the beginning of the study and design. He is advising you on the design and statistical methods, and finally he analyzes the data and is giving some this thing and writing how to write the analysis part. So all these things he is taking part, but then he cannot take responsibility for what has gone on in the lab or what has gone on in the ward. Okay, the selection of the patient, he doesn't contribute. But then he contributes, he has contributed intellectually to part of the study. For that, he also has to take responsibility. Remember that it is not only the first author or the corresponding author, all authors have equal responsibility. Even if there are 50 authors, all 50 authors have equal responsibility. Even the last author also has the equal responsibility. So if you refuse to take public responsibility, if you don't want to take public responsibility, then don't be an author. If you don't take it, that is unethical. Then contents of the manuscript. Now, when you are writing a paper, you must present the truth, nothing but the truth and the whole truth. Okay? So intentionally hide crucial information, unethical. Making false statements, that is unethical. Intentional alteration of data. Oh, if I alter the data a little bit, I'll get p less than 0.05, so that my group, whatever the groups I compared become significantly different. That is intentional alteration of data, wrong. Misquoting others' work. You read others' work and then he has given some positive finding, but then you say that no, it is a negative finding. You misquote, intentionally misquote it, that is wrong. And not quoting previous important work. You cannot say you do something, you can't say that no, I am the first one to do it, whereas you very well know that it has already been done and it has been published. You have gone through the paper, but then you say that no, you simply ignore that work, you are not quoting that work, and then you are trying to take credit that no, you have done it first. Then too many self-citations. Yes, there are some authors, okay, they would have published 10 or 15 papers in the same work, in a similar work, and then the 15th or 16th paper, they quote all the previous 4 papers. Okay, in the 15th paper, they quote all the previous papers. This is too many self-citations. That is unethical. And publishing photographs of patients without consent. If you want to publish a photograph of the patient, you have to take consent. Without taking consent, that is wrong. And you have to, even if you take consent, you have to conceal the identity as far as possible. As far as possible, that is, your paper should not reveal the identity of the patient. If it is revealed, and the patient might be affected, and patient might sue, patient goes to court, you are going to be in soup. Then conflicts of interest. Conflict of interest is defined as a set of conditions in which professional judgment concerning primary interest, such as patients' welfare or the validity of research, tends to be unduly influenced by a secondary interest, such as financial gain. Okay, if you find it difficult to understand this definition, let me explain it. Suppose you are going as an examiner. The university is calling you as an examiner. What is the condition they impose? If you fill up the form, they will ask whether your relative, whether your son, your daughter, your wife, or maybe your something close relative appearing for the examination or not. Now, well, you can claim that no, I'm very honest. No, nothing can influence me. You can say that. You can say that no, we cannot. How can you ask this kind of questions? University, doesn't bother. If your son is appearing, if your daughter is appearing, or if your close relative is appearing, you are ineligible to become this thing because there is a conflict of interest. Okay, there is a conflict of interest. You are supposed to be impartial. You cannot be impartial. No, bias. There is a bias. Bias is subtle. Many times, remember that bias is subtle. You can very well say that, no, I'm very honest. No, I cannot be biased on this thing. Remember that, no, bias is subtle. So now there are, papers. People have written, the articles, the review articles. These people are, the big people in the field. Let us say Parkinsonism. He is a very big clinician in USA. He has treated a lot of, he is a done a lot of research work in Parkinsonism, and he treats a lot of patients in Parkinsonism, and he writes a review article about a drug. Okay, recently, marketed drug, and then he doesn't say that he has got a lot of shares in that company, drug company, which is marketing the drug. He doesn't declare that. Now, what will happen? He is he is an opinion maker. He is an opinion maker. If he says something, people will listen. If he says that this drug is very good, fantastic, and a lot of people are going to use the drug, now what will happen? The shares will go up. He is going to gain. Now, he may be honest, but then this has to be declared. So this is what is conflict of interest. Now, conflict of interest, there are so many, not only the financial gain, there may be a political reason, there may be other reasons of conflict of interest. You have to see when you are submitting a paper, you have to ask yourself whether I have any conflict of interest or not. If I have conflict of interest, then I have to declare it. Remember that conflict of interest is not a disqualification. You may have conflict of interest, it is only a condition. You have to declare it. Once you declare it, then, okay, it is author's responsibility whether to publish the paper or not. Once you declare it, they will simply say that they make a statement. This and such author, has got shares, or he is only, he has got one of the work, part owner of the such and such drug company, which markets a drug which is being dealt in this review article. Something like that. They make a conflict of interest statement. Or you say that, no, you are writing about abortion. Okay? You belong to a religion which says that, abortion is wrong. You are writing against abortion. And you have to declare that, no, I belong to a religion which is which says that, no, abortion is wrong. So you have a conflict of interest. Okay? So this kind of conflict of interest should be declared. Once you declare it, then you have not done anything wrong. So it is a condition, not a behavior. And there is nothing wrong with having a conflict of interest. It is very common. Only thing you have to do is you have to declare it. I'm repeating it again and again because you have to repeat it. It may be commercial, it may be political, it may be personal, it may be academic, or it may be financial. There may be so many reasons for conflict of interest. But if you have any of these reasons, you better declare it. So do not forget to declare competing interest or conflict of interest. Both are one and the same. Then redundant publication. Redundant publication is duplicate publication or dual publication. Do not publish the same data or paper again and again. It is very important. Sometimes one paper was submitted and then you ask, why are you submitting this? This was already published in journal coming from USA. Oh, that is for USA, that is for international readers, and this is for Indian readers. No, that kind of argument doesn't cut ties. Nobody is going to accept it. So you cannot publish the same data or paper again and again. Sometimes you may have to use the same data. At that time, what you do is you write to the editor, this data has already been published, but I am using it here. No, it's only a very minor part of this current paper. I want to use it so that things will get clarified. So that you declare it and then this thing, but otherwise you cannot publish the same paper again and again and again and again. If you have to, sometimes the paper may be published in English. Now you want to publish it in Hindi. Okay, there may be a Hindi journal, or it may be a Spanish journal, or it may be French, some other some other language. You want to publish it. Now what you do is simply you have to inform the editors. You have to editor, you already published. Okay, for this reason I want to publish it. If you want, if it is okay, please publish it. Now the onus is on the editor. If he publishes it, with this thing. Sometimes, okay, this we have published it. Sometimes the editorials we have published. What we do is, I have published in our journal, but then I will say that it has already been declared. So what it is, this editorial has already appeared on such and such journal, and we are republishing it. We are repeating it. So it is the editor's responsibility, but then it is a responsibility of the author to declare it. And the salami slicing. This is another interesting salami. Now we don't eat salami. Salami is common in the West. What you do is you slice it. Now you have you've done some work. Now what you do is you biochemical part, biochemistry of such and such disease. You publish in biochemistry journal. Pathological part, you publish in pathology journal, and another part maybe the clinical aspect you publish in Journal of Internal Medicine. So what you do is with single paper you slice it and publish it in different journals. That is not acceptable. But sometimes what happens is you didn't do your very big work. Now if you see PhD people, they work for 3 to 5 years. Now all the entire thing you cannot publish in a single this thing because it will be too big. So at that time, it will be different parts. So as soon as one part is over, they publish it. Okay, and your paper is too big, then the editor himself may suggest, then okay, you publish it in part 1 and part 2. I have published it like that. When the author asks, it's a very big work. Now what I'm willing to publish in part 1 and part 2. So the same, it's all same topic, but then there's so much of data. It was published in part 1 and part 2. All you have to do is, when you have doubt, you have to simply declare it. You have to ask the editor. Editor will guide you. And plagiarism is stealing others' ideas, contents of the paper, written or illustrative material, and passing it as one's own. Now what you do is you plagiarize few part, okay, few paragraphs, or the entire paper. Sometimes people have plagiarized the entire paper and then they have published it. Others papers they try to publish it in another journal. Even in our journal, it has been published and it has been withdrawn. One of the journal, I think Journal of Pharmacology and Pharmacotherapeutics, we have published it, and then finally we saw the data was taken from some other this thing. One reader, he alerted us. This data has already been published, and we saw the reader was correct. We asked for explanation, and then we withdrew the paper. Okay, retracted the paper. So plagiarism is stealing others' ideas. Even if you steal the idea, that is also plagiarism. And contents of the paper, mainly most of the times it is very difficult to find out whether somebody has stolen the idea or not. But then the contents of the paper, it is stolen, then you can check it. There are a lot of plagiarism checkers are available, like Authenticate, and so many plagiarism checkers are available, and you use the plagiarism checker to check. Now most of the publishers, what they do is they have the plagiarism checker. They go through plagiarism checker. Now what you do is the institutes, suppose you are in an institute should have facility to check plagiarism. In JIPMER, of course, I took I took initiative in this, and we purchased long back. This is 10 years, at least 10 years back. We subscribed to Authenticate. Authenticate is a plagiarism checker. Authenticate, and then we give account to each faculty member will have an account, and whatever the students know, paper or their own paper manuscript, they can put it, and then they check this thing, it will find out. And when they want to submit thesis or dissertation, there is a committee called Plagiarism Checking Committee. The Plagiarism Checking Committee again uses Authenticate, and then finds out whether there's any similarities are there. It gives a report, and then there's so much of similarities there. The people, the students will rewrite and then resubmit. They have to get a plagiarism certificate from the Plagiarism Committee. Then only they can submit the dissertation or thesis to the institute. Copying large portions verbatim from others' papers is plagiarism, even if references are given. Some people argue that, no, I have copied, but then I have given a reference. That is not correct. No, you cannot copy it. But sometimes, definition you don't want to change. You cannot change. So what you do is, definition you can verbatim, you can write. But then what you do is, you have to indicate that, no, it has been taken from some other journal. Now what you do is, you italicize it and indent it. The paragraph, if it is a paragraph, if it is one paragraph, you indent it, italicize it, give it within quotes, and then give a reference, and then say that, no, this is taken from this reference and this thing. So if you do that, sometimes illustration, some graph or something, you want to take it from this thing from PhD thesis or from another journal. So that also you can, with permission, you can take, and then, but then you declare it under this thing. In the footnote, you have to say that this illustration has been copied, or not copied, adopted or let us say, reproduced from such and such article, such and such journal. Then otherwise, it is plagiarism. Then undeclared use of AI. This is a recent thing. Artificial intelligence. Now what you do is, you give all your data, the AI will write the paper. Or you feed your dissertation and ask it to make a paper, it will make a paper. Now, if you are using AI is not wrong. Using AI is not wrong. Now, what you do is you have to declare it. If you have used AI to write, let us say, you have written everything, but then discussion is difficult. You find it difficult, and ask the AI to write discussion. Then you have to declare that you have taken help of the AI. Which AI? Whether it is Gemini, or it is ChatGPT, or it is Claude, or I have used this AI tool to write my discussion, and I have checked it. Remember that, AI, don't believe AI. Okay, AI is like Google Map. How many of you know? At least once we have experienced that Google have misguided us. Once in Coimbatore, we wanted to go to my friend's reception. Finally, we ended up in Sudugadu. Okay, that was a real joke. Because it is the other side of what do you call it, Sudugadu in English? I'm sorry, suddenly thought block. Okay, that is a
symmetry.
Yeah, symmetry. So it is the symmetry. This thing is the other side of the symmetry. So Google Map misguided us. We ended up in symmetry. So you can't completely believe it. Even AI, you can't completely believe it. You have to check it. If I use AI, yes, I use AI, but then I go through each and every word to check whether what it said is correct or not. Finally, it is my responsibility. Okay, so if you are using AI, you have to declare it. Now, no journal says that don't use AI, but then you have to declare it. Then acknowledgements. When you acknowledge the funding or sponsoring agency. Now, DBT or DST has given funding, you have to acknowledge it. If you don't acknowledge it, it is wrong. Even some private agency or your institute has given the funding, you have to acknowledge it. And don't acknowledge routine work or duty. Your routine work, your PA has typed it. No, she has paid to type. So there is no need to acknowledge it. And data collectors. You have paid some data collectors, they have collected data, gone through K-sheet, they collected, they have been paid. No need to know this thing. Then technical work. Unless otherwise he has done something out of ordinary. Okay, he has contributed significantly. He has come out with some new idea. Then you can acknowledge. Otherwise, no, you don't have to acknowledge. He has done a routine work, don't acknowledge it. And acknowledging the head of the institution. Now, if you see, most of it, thank you for the director. I thank the director for permitting me to do the work in the institute. What nonsense is this? You are part of the institute. It is a director's responsibility to facilitate you to do the research work. That is his duty. So there is, of course, he gives permission and all these things, but giving permission is routine duty. He is supposed to do it. There is absolutely no need to acknowledge the head of the institute. There are a lot of other things. I'm not going into so much details. Okay, how much time did I have? It is almost time.
Okay. Sir, another 10 minutes should be fine, sir.
Okay. So these are, as I already told you, I listed some common unethical publication practices. These are common ones. There are others also. The list is not, as I said, the list is not exhaustive. The other ones. Now I am going to give you some real, some scenarios which really happened in my experience, and we will discuss at least a couple of them. A faculty member in a medical college received an acknowledgement from a journal for submitting a research paper. The faculty member replied to the editor that she did not submit any paper and hence she cannot take any responsibility for the paper. It was found that her former student submitted the paper without her knowledge. The work was carried out in her lab and the student included her name as a corresponding author. This really happened to my colleague, my friend, my longtime friend. Okay. See, she was working on sleep laboratory. I have a pharmacology department. We had a sleep laboratory, and she was working on sleep medicine. And this is a medicine PG. She did her dissertation. Now, part of the dissertation, in our laboratory. And once she completed and she went and joined some other college, suddenly, my friend is receiving a mail from one of the British journals. He said, "No, what is this? No, I have not read the paper, manuscript. Now I can't take any responsibility." And then she called the student. The student, no, ma'am, no, I wrote the paper. I only submitted and this thing. And this is what has happened. So if this happens to you, of course, some people, when I take this session, I used to go display this. I used to ask the audience, "Now, what do you think?" Most of the people say that what the faculty member did was correct. Some people they have different opinion. They say that they call the student first. Okay, even if you call the student first, it has already been submitted. What she did was wrong, and you cannot take any responsibility. Suppose there is a false data, fake data, and it gets published, and then this thing finally, then you cannot say anything. Okay, so nowadays you publish a paper, you submit a manuscript. You have to give email IDs of all the authors. Now the journal send this thing to all the email IDs, all the authors' email IDs, and they say that the paper has been submitted. So that is at least, if I have not gone through the paper, at least at that time you should have gone through the paper. If you are keeping quiet, you are agreeing to whatever is said in the paper. So it is here. What she did, in my opinion, what she did was correct. She refused to take any responsibility, and then they called the student, and then they finally she submitted the paper, a manuscript, and then she went through it, and then she approved it, and after that, it was submitted to some other journal. A manuscript which was submitted to a journal was found to include a large chunk of data published already by the author in a journal. When asked, the author explained that he has used only part of the data published already and added some new data to make one more manuscript. Now, this is clearly wrong. Now, what you should have done is, you should have declared, okay, when you are submitting to the second paper, you should have said that in the first paper, I have used some data. I used some data to publish the first paper. Now, this is my second paper. I have more data, and paper is much more interesting with the new data. That is why, I can't avoid the data which was already published. So I have included in this. So if you had said this and then onus is not on him. But once you have published it and then somebody points it out, then you are going to be in trouble. In a review submitted for publication, it was found that few paragraphs were copied verbatim from another review published earlier in another journal. When the author was asked to explain, he said that he had listed those articles under references and cited them in the running text, and hence he can use the paragraph word by word in his review. This is a wrong notion. It is not correct. In that case, you don't have to write any discussion at all. Like this, you take 10 papers. Suppose you work in the area of Parkinsonism, okay? Drug treatment in Parkinsonism. You take 10 articles. You take one paragraph from each article, and then you make it all one by one. You put it under the discussion and say that your discussion is over. No, that is not correct. This is not. You can't verbatim. You cannot write. What you have to do is you have to read this thing, and then you have to write it in your own words, with your own conclusions, your own opinion, not conclusions, your own opinion, your own views. You have to rewrite. Whatever they written may be very good, but then now what you have to do is you have to write on your own words. Okay, this paper has said this, they has reviewed this, we agree with this, or we don't agree with this. Something like that you have to write. An author submitted a paper with partial data when the whole data were available. After publication, he submitted the entire data to Drug Control Authority with a conclusion different from the one he drew in the paper published in the journal. In the journal, he said that no, drug has got a lot of positive effect, it is very good and all these things. And then when you are submitting to the Drug Control Authority, DGCA, he submitted the entire data, and then he said that no, drug is not very effective, or it is least effective. Okay, if you are doing this, again, it is very, very unethical. When a paper was about to be published, the authors wrote to the editor of IJP, that is Indian Journal of Pharmacology, he was the editor at the time, that he would like to withdraw the paper. The reason given was that he submitted the paper to another journal earlier, but he did not hear from them for a long time. His remaining letters were not replied. Hence, he decided to submit the paper to the IJP, but they subsequently found that that paper was published in the journal he first submitted, and hence the withdrawal. Now here, the authors were from a different country. Now what they should have done is they should have told me that now they already submitted the paper, they didn't hear from them, so they are submitting it, that they didn't declare. Of course, I can understand that, because many journals, what happens is you submit a paper, they won't reply at all, they won't acknowledge. You keep on writing to them, they will never ever reply. Now at that time you do not know what happens. Now you have to know, if you don't publish it to your paper within a year, and now this thing may be old, your data may become old, or your similar data might be published by somebody else. So you have to publish it as soon as your work is over. So there is a pressure. Now here, what the author, now when he said that, no, I accepted it. So I said, okay, I allowed them to withdraw. But what the author should have done is, this is what we have done. We have already submitted, but then we didn't get any reply. It has been already 3 months. Now we are submitting to it. This they should have done. They didn't do it, but I presume that they didn't know this. They didn't know this. I advised them, and then I allowed them to withdraw the paper. A research work on usefulness of a particular type of exercise in patients on diabetes mellitus was submitted to a journal. On finding no mention about the ethics committee permission, the editor of the journal asked for a clarification. The authors replied that they have taken informed consent from all, and argued that since the study did not involve any intervention, there was no need to take ethics committee permission. This is again wrong notion. Any data collected from any human being, whether you have used interventional procedure or non-interventional procedure, you should have to take ethics committee permission. Remember that any data from patients, I'm not talking from taking data from already published papers. No, any data from patients, your patients, it may be the procedure may be interventional or it may be non-interventional. Just simply some asking 10 questions, and then you take the response, and then you are publishing it. Even that needs ethics committee permission. So the argument of the author is wrong. Okay, informed consent you have to take. You should have taken ethics committee permission also. A paper published by a senior researcher contained fabricated data. When the editor asked the researcher, she admitted the data were false, but her junior did it without her knowledge. Her statement found to be true on the inquiry. Yes, She was correct. The data was fabricated. She didn't know, but then she also had to take responsibility. She cannot shirk responsibility at this stage. She should have checked. Nobody is going to accept that, okay, fine, it is all your junior, you have done it, so we are going to leave you. No. Now, she is going to be in trouble. After the results of a clinical trial of a drug was published in a journal, a colleague of the authors wrote to the editor saying that the study was fully funded by a drug company, but the information was not revealed in the paper. This is also can happen. Now you take drug, money from the drug company, do the study, and then you are scared that, or you are a bit skeptical that journal might not publish it. So you simply don't want to mention the drug company name. This is going to be this is definitely unethical. The number of original publications came out from a college in the year 2011 was 107. More than 100 papers included the college principal as the last author. Almost every paper included the respective HOD as one of the authors. Now, this I have seen. There's one college, one pharmacy college, the director or the dean was in every paper. Whatever paper was published, he was the last author. This is unethical. After a paper was published in a journal, the editor received a letter from two workers belonging to the department from which the paper originated, that the data published in the paper were collected by them in a field survey and they were not given authorship. This also case came to me. Okay. One student, he blamed his faculty member. What the student did was simply collecting the data. He didn't intellectually contributed, and I went through this thing, and then I asked questions, explanations, and all these things. Now here there is no intellectual contribution. There's simply no data collection. There's two people, they collected data and then they gave it to a researcher and then he analyzed it and then he wrote a paper and published it. So the data collection, they might have got some remuneration or whatever it is. Simple data collection doesn't deserve authorship. Okay, thank you very much.
Thank you, sir. That was quite elaborate, and illustrative examples were really very useful. And I think the wisdom of writing a paper, especially conforming to the ethics that is expected of it, is it itself requires a great deal of guidance. So, what kind of documents govern the ethics of publication, sir? If a young researcher wants to publish a paper, what should be a source of reference? Where he or she has to look upon to guide himself or herself to publish the paper in biomedical research?
See, one thing is you have to go through instruction to the author. Whichever this thing, they will very clearly say what to do, what not to do. That each journal will give you this thing. They all these statements and this thing, declarations, whether you have to give acknowledgements and then whatever the conflict of interest statements, all these things. First thing you have to do is go through the instructions from top to bottom, from the title to the end of the distinct instructions. You follow the instructions, most of the times you will be correct. And number two, you have a doubt. Now you ask the editor, okay, along with the paper, you have done something, okay, I have done this, I do not know whether this is right or wrong. You please advise me. They will advise you. So the first thing is the instruction to authors. Second thing is, when in doubt, you declare it. If you do these two things, you are okay. But otherwise, I don't think there is any site which says that this is ethical, this is not unethical. There are lots of papers. You can see, you can go through papers or publication ethics. Like you type publication ethics, the papers will be there. You go through the papers and then they will tell you what to do and what not to do. This is like, knowing the rules of the games before you enter the field. You want to play some game. Now, what you do is, first thing you do is you have to know the rules. Now, entering the field and then you say that, no, you didn't know that, no, so that's why you made a mistake. No, nobody is going to accept that. So first you have to roll the rules of the game. So for that, well, on the net it is available. instruction to authors. First, you read the instruction to authors, you will be all right.
Sir, can there be single author publications?
Yes, if you see in the past, there are a lot of single author publications. Nowadays, it is very rare because the research has become so complex now. Yes, if you are the only person, you have done it and this thing, yes, you can single author publication, this thing, but definitely it raises some eyebrows, if not suspicion. They ask you, suppose if it is let us say, laboratory work, if it is a clinical work, definitely, the author might, the editor might ask for some clarification. Yes, but suppose, let us say, it's a retrospective work, some case sheets. You have taken 100 case sheets and you have painstakingly, you have gone through the case sheet, you have collected the data and you are publishing it now in your own name as a single author. Yes, why not? There's nothing wrong in it. Single author, no, nothing wrong in it. But as I said, it would raise some eyebrows.
So similarly, suppose a person is practicing in a clinic, and then ethical committee. So
Yes.
whatever he is saying in his clinic, so who is going to be his ethical committee?
Yeah, that's a very good question. There is no clear-cut answer. Previously, ICMR, what they do, this thing is, you approach the nearby medical college ethics committee and then get permission. Just a minute. Okay, but at the same time, it is not only for practitioners. There are research institutes are there. They may have their own ethics committee, or there may be independent ethics committees. There are independent ethics committees. But the problem with independent ethics committee is you have to pay. They will say that no, for each approval, you have to pay some 25,000 rupees or 10,000 rupees. You have to pay money. This independent ethics committees can go through and then they can give you clearance. That is also acceptable. But you have to find out
Nearby area, within
nearby,
50 kilometers. Within 50 kilometers,
yes,
there is a
yes, independent ethics committee or medical college. If the medical college is agreeing to this thing, and best thing is, if you are this thing, you can now include somebody from the as a your co-worker. Of course, he also should intellectually contribute. Of course, suppose now you are working on some disease, diabetes mellitus. Naturally, nearby medical college, there must be somebody who will be working on diabetes mellitus, or there may be a diabetes expert. And then now you can approach him, whether he will also intellectually contribute or collaborate with this thing. Then this thing will be easier. You can get the permission from the ethics committee and things will be easier. Yes.
Thank you. Thanks, sir. Last question. Not related to this. I was following you in MBBS in Tanjavur, and also I came to Jipmer when you were there, and I joined your lab. That time when I got a DRTO, I told you I am going to leave DRTO. You never said that you are going to start a sleep lab. I would have joined in your lab.
No, sleep lab, I'll tell you, there was a scheme, Tokten scheme, Tokten or Tokten. In the early 90s, there was a scheme brought by a central government. So what they did was, they funded an expert from USA or UK. They can come to any college here and then they can transfer their expertise. They can find a researcher and then they can transfer the expertise. There is a sleep expert called Nataraj Sitaram. If you see Sitaram, his name is mentioned in, I think, Sitaram classification of, he's a psychiatrist, classification of DSM, DSM classification of, his name, he is a big man in psychiatry. And he came from USA he studied in Jipmer. So he came from Jipmer. He brought the sleep equipment machine in 1995. And then he trained my colleague. And then he set up the lab. He was here for a couple of months. And he trained people here. And then now my colleague took over. And then now she set up a lab, full-fledged lab. So got some sleep equipment. And she ran the sleep lab till 2010. Okay, from 1995, almost 15 years he ran the lab. And after that, now she had to go to WHO, and then she closed the lab, and then it was given to clinical pharmacology, and also another neurology also have sleep lab now. So it was not started by me. It was at that time, 1995, when the lab was started, I was in Nepal. I was deputed to Nepal. I was working in Nepal. When I came here, the sleep lab was, it was being set up.
Thank you, sir.
Yeah.
Sir, Professor Bose sir has made a few comments and he has a question. Professor Bose sir, நீங்க டைரக்டா அன்மியூட் பண்ணிட்டு கேளுங்க
yeah,
சார்.
right. I think okay. So it's okay. So I wanted to ask you one important thing, because it's an era of forced publication where we ask all our postgraduates to publish and all that.
Yeah.
So how do you really get the idea to do one publication, and is there a quick SOP for that?
Idea for publication, first you have to do the work.
That is very difficult. Okay.
Any publication, publication, there are different types of publication. I didn't go into all the details. There may be a review article, research article, and research article, there are so many types of research: retrospective research, prospective research, clinical trial, and simple case series, even some case studies, some case report. So like this, there are so many types of articles are there, and reviews. And review, if you take review, there is a just a narrative review. There is a, what do you call it? You go through different papers and analyze the data, and then you can publish a paper.
Meta-analysis.
Meta-analysis. And so there are different types of papers are there. Now, it's all depends on your interest, which area you are interested. I am interested in one area. Okay, hypertension. Hypertension is my area. I'm interested in this. So that is my special interest. Now I work on that. Hypertension, treatment of hypertension, or treatment of hypertensive complications. Okay, only I focus on complications, drug treatment of hypertensive complications. So I choose patients and then I treat, maybe a new drug, or somebody in a company is approaching you to do some clinical trial. You agree to do clinical trial. So like this, you do some work or some retrospective work. Now hypertensive complications. Now you want to see, the patients. Now what is a hypertensive complication? Is there a difference? Is there a difference in hypertensive complications from 1980 to 1990 and 2015 to 2025? This, it is all very, in between there are 20 years or 25 years. And is there any difference in the hypertensive complications? So you collect all the case sheets and then you get this idea. Because you are interested in hypertensive complications, you collect the case sheets and then you collect all the data. And this you can make a paper. It may be a very good paper. It might throw some lot of insights. It might throw some new this thing. Sometimes you find that the complication which was not there in the 80s to 90s might start appearing in 2015 to 25. That may be a very good finding. Okay, and it may be appreciated by everybody, and you may be treating it. So like this.
Have you had any publication on that? Have you done some work on that? How to do it? Is there an SOP, clear SOP as to how a student should proceed?
No, that's a book. I have written a book on for postgraduates. A practical approach to PG dissertation. If you see that next edition is going to come, maybe in a couple of months, next edition is going to come. Already 2 editions were there. Last edition was done in 2011 or 10 or 11. If you go through this thing, it starts from how to get an idea. Okay, how to get an idea to how to publish it. How to publish it. So the entire thing is covered into this thing. It is like a SOP. As you SOP, you go through that, and then you'll get an idea how to start a work and how to analyze the data, how to publish it. Everything is there.
Is it available? And you have the thing, you share it with us. Like, it will be nice if you can share the.
No, it is a book. It is available online.
Online, is it? Okay.
Some online Amazon or something. The book is available with the publisher also. You may wait for a couple of months. The next edition is coming with AI, artificial intelligence. There is a section on AI also.
Very good.
It may be coming. I'm going through the second proofs.
Okay. The next question is about your Salami slicing, right?
Yeah.
That's a very interesting part, because we find a lot of papers being reproduced from a single topic.
Yeah.
Okay, my question is, for example, if you have a CA breast yearly and rate presentation, the same institution,
Yes.
and it is submitted separately regarding presentation, pathogenesis, and outcomes,
Yes.
right? Would you call that as salami slicing?
Well, as I said, if it is a very big work, now the journal is not going to publish because it is going to take 50 pages or 60 pages single article. No, journal may not say no. The journal may say no, or they themselves may say that no, you can split it into a couple of papers and then you can publish it. Now, if you are doing a PhD work on this, you do one part first and then no, you'll go to next part. Then you need not wait, no, complete the whole thing. Because by the time, no, whatever you've done in first part, it becomes some other may also done some similar work, he will publish it, then he will get the credit. So one part is over, you publish it. Okay, fine. But then the entire work itself is a small work, not a big work. And then there's a pathology part, there's a biochemistry part, there is a kind of a clinical part, there is some other microbiological part. If you want to slice it into different journals, that is salami slicing. It is very difficult to say give a clear-cut definition or clear-cut guidelines on this. It's all you have to know. Yes.
And that should be decided by the editor or by the author.
Authors will decide. But if you have a doubt, you can say the editor. You can tell the editor, oh, this is what we have done. It is okay or not. Now put the onus, put the responsibility on the editor. If editor wants, he said it's okay. It's okay to publish. He will publish.
Sir,
Okay, thank you.
Yeah.
I have a question, sir. I was involved in a study where the study was initiated by an author in a different center, but she kind of asked us to collaborate with her and wanted data, patient-related outcome data from our own center. So there were 3 participating centers. We were providing data, but there were a lot of issues in terms of designing the study. So I contributed in terms of what should be the design, how you want to go about it, how you decide the data capture sheet or the pro forma for the study. And then we had a lot of back and forth discussions on that. And once we have done that, the individual centers which are participating were just providing data for it. And when it eventually, prior to publication, I said, see, I have contributed significantly in terms of designing of the study stage itself. So you should give authorship to all participating centers. It's not just you take data from us. So she flatly refused. So I withdrew all the data and I kind of said, I'm not going to give you any data any further. So you can probably go ahead. But then that left a lot of hurt because we spent quite a lot of time in designing the study. In fact, I wrote it down, sent her, pages of documents and all that. But she eventually went ahead and published on her own name with one single center, but whatever data she had. So if this kind of situation happens, what kind of an action does the peeved doctor could make?
Yeah, I'll tell you. This authorship is a vexatious problem. Authorship, there are lots and lots of problems occur because of authorship. One way to avoid it, when you are planning the study, before you carry out the study, before you submit your protocol to ethics committee or whichever committee, research committee, everything, you decide these people will be authors. In that case, there will not be any problem. And author, if you want to be an author, you have to significantly contribute. And ICJME, that is International Committee of Medical Journal Editors, there is a committee. It met in Vancouver long back, and then they say all the authors should have contributed at least in particular some aspect, few aspects. One is they should be involved in designing of the study. Number 2, they should have executed the study, collected data, and then they should have contributed for writing the paper, and they should have gone through the paper in revising and all these things, analyzing the data analysis also. That is analyzing arranging and analyzing the data. Okay, so all this, the entire thing, the author should have involved in all these aspects, and he is definitely he is qualified to be an author. But then sometimes there may be exceptions, like a statistician. Now, if you see the big studies, the statistician is a part of it. He will be there from the beginning of the study, even the design of the study. Even now, statistician design the study. There are statisticians who are very good in the clinical trials, and you design the study. I mean, they will go through, they will make some changes and all these things. They will do all these things, but then they cannot touch the patient. They won't be collecting actual data, but then they go through the data. They go through the data. They analyze the data, and then when you're writing the paper, when the conclusions and all these things, they'll go through and everything. And they may not contribute to one part, but then they would have overall, if you see their contribution, there will be a significant intellectual contribution. So I would, in my opinion, from what you have said, you have intellectually contributed. You have designed the study, you have contributed the data, and they should have, when they written the paper, they drafted the paper, they should have given it to you. They asked you to correct it, or they asked you to go through it. They should have asked you to approve it. They should have included you as an author. If they have not done it, that is not ethical. So to avoid this problem, at the beginning of the study, you should say that, no, who is going to be an author? Who are all going to be an author? Participating center, how many from each center, who are all going to be an authors? So this, if you have decided this thing and put it in writing, the protocol or whatever it is of this thing, then finally they cannot refuse. Now, in JIPMER, especially if there's a collaborative study, they have to take permission. So at that time, the committee asks whether have you decided about the authorship? Who is going to be an author? Whether you will be given authorship or not, or you are going to simply giving some data and then keep quiet. What if it is there? I mean, no, the institute will not approve the study. Now you are going to simply give the data and you don't get authorship, then in what way the institute benefits? Then no, they want this thing. In the clinical trial, of course, in the clinical trial, the sponsored clinical trial, things are different. Sponsored clinical trials, the drug company trials, you can't publish it, your own data. Everybody has to publish. Only the company will publish it. And there are so many things are there. There are confidentiality agreements. So many things are there. But in a collaborative study, the committee will ask who are going to be authors. You have to, in the protocol, you make it clear.
Yes, sir. Yeah. While on the subject of ethics committee, what happened is there was one doctor who had an undue influence with an ethics committee. Yeah. And she went ahead and kind of arm twisted the committee to approve her paper and went ahead and did the paper. And there was another instance where one ethics committee disapproved of somebody's study. And then he went to another ethics committee and got approval and went ahead with the study. So this kind of things, how to actually understand these things, I'm not sure, sir.
Yeah, another big problem is ethics committees. Okay, ethics committees. See, the institute, we have 2 ethics committees, but then now the roles are different. When the interventional study goes to one committee, non-interventional studies goes to another committee. Okay, so you can't submit it to any committee as you like. There is a clear-cut definition. You have to submit to one committee, and again you have to go back to the same committee. Okay, you can't go to any other committee like this. I mean, no, it is not possible. It is not that should not be done. And undue influencing ethics committees is wrong. This at all, the ethics committee chairman and the ethics committee secretary, they have to see to that ethics committee is functioning properly. Of course, that doesn't come under publication ethics. Okay, that is a publication has nothing to do with that. But then if somebody is doing that, that is a misconduct. That's a research. Somebody is influencing the ethics committee. That's a research misconduct. And the ethics committee is also at fault. Ethics committee should be very careful at this thing. And sometimes they won't give you, there may be a personal grudges and all these things and all come into the picture, and there'll be a lot of argument, there'll be a lot of discussions, and everything goes, and then yes, things happen. Yes, I agree.
Sir, there are the Indian Medical Association, individual branches, they have ethics committees, sir.
Okay.
Small hospitals or medium-sized hospital people who are wanted to publish, they go to this ethics committee and then try to have a discussion and then try to publish. But my question is, who approves of the ethics committee? Do the ethics committee have to be registered, and who are all entitled to run an ethics committee?
Yes, ethics committee has to be approved. Ethics committee has to be approved. Ethics committee, there are two things, CDSCO. It should be approved by DHR. The current this thing I do not know. There is a Department of Health Research, that is the ICMR, and there is a CDSCO, that is a Drug Control Authority. So CDSCO, no, you have to submit papers, all the paperwork and everything. They have to approve it, and they will give approval only for a particular period, 5 years or some this thing. Then again you have to go for renewal. Okay, CDSCO. I was briefly working in Mahatma Gandhi. At that time, what happened was their ethics committee, this thing was expired. Okay, ethics committee approval expired, and then they applied, and there were some queries and this thing. And again, it was brought to my notice, and then we wrote to them. I mean, they were delaying it. Actually, they applied well in advance, but then the CDSCO was not looking into it. So I had to ring up. The Drug Controller of India. Luckily, the Drug Controller of India was in the selection panel. I was also one of the members. So Drug Control of India, I said that no, it is getting delayed, and because of that, we are not able to conduct the clinical trials. The application is pending, and then they went through it, and then finally they approved. Okay, so the ethics committee should be approved by the I don't see DHR. I don't know. I think two agencies. There is one with ICMR and other is CDSCO. CDSCO. That is a Drug Control Authority of India. So they have to approve it. So you have to get the approval, then only it is valid. Otherwise, it is not valid. Your ethics committee is not valid.
One final question, sir.
Yeah.
There are a lot of publications on ethnopharmacology by alternative system medical practitioners. I wouldn't say medical practitioners, but institutions run by them.
Yeah.
And some of these publication material are not, good quality randomized clinical trials. Most of them are descriptive data and stuff. So we find it being published extensively. In fact, if you go online and look at the papers published by the Ayush, then it is phenomenally a huge number of publications are seen. And they keep quoting this left, right, and center to push their products and stuff in the market. So this sometimes becomes, whenever you have a reasonable discourse with somebody and ask for evidence, they submit these papers as evidence. And we find that it's extremely hard to argue that these are not good quality evidence. So why would this kind of scenario, are they really only science practitioners should publish in journals, or non-science medical people can also actually do this?
No. See, Ayush has got a lot of money. Okay, you can very easily get the funding. And these people, they approach the medical colleges, pharmacy colleges, and then they say that, the study has to be done. What you're saying about the good quality, the quality is, it lacks quality, yes, that is true. And if you see, most of them won't have proper control. Okay, without control, you publish something, that's a very, very poor quality, this thing. Yes, the quality is questionable, and there are many papers are of very poor quality. Now, why they get published is, remember that 95% of your research work, it gets somewhere, first you submit it to Lancet or any JM, it gets rejected, then you publish it, then then the second time, the next this thing, kind of journals, this thing they reject, then you get rejected from another journal. Finally, there will be some journal which will accept. Okay, there's a kind of journals called the predatory journals. I didn't discuss that. Predatory publishing in a predatory journal is unethical. Predatory journals are journals run by people who have got no commercial interest. You give them 5,000 rupees or 15,000 rupees or 25,000 rupees, and today you send the paper, tomorrow they will publish it. They won't even, look at the paper. They want no peer review. Peer reviewing is very important. Okay, they don't send it for peer review. Today you send it, And then no, they say that no, you pay 15,000 rupees. I'm not saying that all the journals which ask for money are no predatory journals. No, some journals, they only money is the only criteria. You pay money, whatever you write, they publish it in the journals. These are called predatory journals. You don't publish it in a predatory journal. No, that is wrong. And these journals, they today they will be have online presence, and tomorrow they'll close it and then they go away. So don't publish it. Then publishing in a predatory journal is wrong. Okay. So what is the criteria for predatory journals? Sorry, I won't go into details. And there are a type of journals called predatory journals. Publishing in predatory journals is unethical.
Yes.
Yes.
Are there any more comments or questions from the audience?
Thank you, Raveendran. It was a very nice, eye-opening lecture. And as usual, as our introduction was given, you are really out of the box thinker. Thank you.
Thank you. Thank you, boss. Thank you. Thank you. Let us close it. I'm sorry, my throat is not all right.
Yes, sir.
I mean, no, something has gone wrong with my throat.
Thank you so
Thank
much
you.
for the 14th for attending the 14th edition of TMC Medalogs. I sincerely thank Professor Raveendran sir for despite having suffering from a poor throat, he was able to give us a wonderful lecture and outline on ethics. And this session will be recorded and uploaded quickly for the benefit of the larger audience and students. Especially, they should have a very clear understanding of what is ethics and how to go about it. And in the next subsequent session, coming 23rd, we will have something more on a public health related topic. It is supposed to be extremely interesting. So I sincerely request everyone to attend the talk on 23rd of November. Thank you so much. Thank you all for attending our program. Thank you once again, sir. And thanks for your.
Thank you.
Thanks.
Thank you,
Thank you, sir. Thanks, sir.
Thank you.
Take care and stay safe.
Thank you. Bye-bye.
Bye.
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 Let me sign off. Yeah. Thank you. Bye.